Okay. All right, guys. I'm just here to talk to you for just a minute about the opioid crisis, something that's really a big deal right now in our nation. By the end of this presentation, it'll only take a few minutes, but you should be able to identify about 3 signs of opioid abuse and one way that you, as a nurse, can help combat this crisis. I'm going to give you a few statistics. The CDC reported in 2016 that 63,632 Americans were killed by drug overdoses, and 66% of those deaths involved prescription or illicit opioids. From 1999 to 2015, 183,000 people died in the U.S. from overdoses related to prescription opioids. And the most common drugs involved in these deaths are oxycodone, hydrocodone, and methadone. It's interesting to note that the World Health Organization stated that before 1995, prescribing opioid painkillers in the U.S. Was limited to people with pain from advanced cancer, severe injuries, or other major surgeries. Nowadays, it's pretty common to get an opioid painkiller prescription for even minor oral surgeries. In 2012, more than 250 million opioid prescriptions were written in the U.S., and that was more than enough for the entire population. So this prescribing, overprescribing, and overuse of opioids poses a crisis that threatens the health and safety of patients as well as healthcare providers. This has impacts on several areas of healthcare. In 2007, it was estimated that the costs of prescription opioid abuse were above $55.7 billion. Opioid abusers are more likely to utilize medical services like the emergency department, outpatient physician visits, and inpatient hospital stays, and this is draining our healthcare resources. Unintentional opioid deaths are quickly on the rise, and the unnecessary prescribing of opioids are a major contributor to this. Something that impacts healthcare as well, with patient satisfaction surveys directly affecting reimbursements for hospitals and clinics too, providers are in a predicament. Any patient who isn't given the opioids that they're seeking will score low on the satisfaction survey with the hospital, and in turn, if this hospital continues to score low, they will not get reimbursed. In order to combat this, new tools and guidelines have to be developed for other ways to manage pain. Acute care providers should be educated since the ED is a common stop for many opioid seekers. Some signs and symptoms of opioid abuse to be aware of. In patients and laypersons, signs can be physical, behavioral, and psychological, not being able to stop using the substance, nausea, vomiting, physical agitation, slurred speech, mood swings, depression, and irritability are common. And believe it or not, this problem is also common among healthcare providers, those who are absent from work frequently without notification, who spend an excess amount of time near a drug supply, have heavy wastage of drugs, and difficulty concentrating, and increased isolation are some signs to look out for. Ways we can help combat this threat is the use of electronic medical records. These help us identify patterns of visits for patients to see if their pain is acute or chronic. Prescription drug monitoring programs allow practitioners to access data on controlled substances, so they're able to see how many prescriptions of opioids the patient has obtained. And then we also have to find alternatives to pharmacological medicine, such as deep breathing, relaxation, physiotherapy, and even music therapy can help. What we can do as nurses is educate our patients on alternatives for pain relief and the dangers of addiction. We also need to work with other healthcare providers to minimize the use of opioids and implement strategies such as IV Tylenol, oral anti-inflammatories, and muscle relaxants do a really good job of helping to control pain. We also need to advocate for our patients who have addiction and direct them to resources for help. researching evidence-based practice to show that there are alternatives to prescription opioids, and work to have these protocols put in place at your workplace. Thank you.